Ever since I was 8 years old, infatuated with catching a Goliath Grouper.
In your mind, is this going to be the same one that like spooled you that
absolutely.
time?
When I was 8, the one that broke my rod in my parents' backyard, absolutely. This is going to be redemption. Is what I'm looking for here. I've been hunting ever since.
Billy was scarred for life by a Goliath Grouper when he was 8 years old.
Yes.
Everything hasn't been the same since.
No. I mean, this is like 20 some odd years in the making. I've been ready.
My name is Tim Hart. I have been in the mortgage business in Southwest Florida since 2001. I have had many goals and ideas for my mortgage business, and 2 of them are to have my own fishing show and to give a platform to Southwest Florida business and community leaders. Well, I was finally able to make that happen by combining the 2 ideas into one. Welcome to Rates and Reels. Enjoy the show. Hey, what's up everybody? Welcome to another episode of Rates and Reels. My name is Tim Hart from Van Dyke Mortgage. I'm here with my special guest today, Dr. Billy Truax.
What's up, Timmy? How we doing?
Good, man. Thanks for coming today.
Thank you. I'm super excited.
Cool. So you guys, what we did was we auctioned off an episode of Rates and Reels at our school auction, St. Michael Lutheran School. Dr. Billy and I serve on the school board together. You know, our kids are all buddies.
Yep,
right?
Playing baseball, going to school, having a good time on the playground.
Yeah, same grade. You know, they're future troublemakers, I'm sure.
Future or present, for sure.
Either one. So you guys, Dr. Billy, we're gonna go out fishing today. Hope we catch some fish. It's gonna be awesome. And you ready?
The weather's good. I'm excited.
Cool. Hope you guys enjoy the show. Have fun. So guys, where we're at is right around Boca Grande. We got a huge mullet that Captain Bo just caught. We're gonna see if we can get a Goliath Grouper on here. Dr. Billy's been wanting to reel one in, so we're gonna see what happens here. You know when the captain throws the bait in the water and then says good luck to you?
Yeah.
You better be ready. Well, don't blow it, man.
No, thanks.
Yeah,
I appreciate it. Be like Dane Eagle and blow the tarpon bite. So I just need something to live up to. You know, Pastor John missed a couple bites. I think all your guests have missed a couple bites.
Don't be that
so
guy.
So I don't want to be that guy at all.
You blew it, dude. You said you didn't want to blow
I did. I pulled a Dane Eagle. I did it.
First bite he gets. He was worried about blowing it, and you blew it.
I did.
Talking all that trash.
Oh, it was 2. When you get a terse, oh. Nope. I did.
I had said that Billy wasn't going to blow it again, and Dr. Billy did
cursed
blow it
me.
again.
I did. Bite. Come off.
He blew it again. Not dogging you here, man. I think you're 0 for 5.
Oh. Yeah.
Over 5?
Yeah. Oh, there we go. Nope. Nope. Oh, here we go. Oh. Yeah. Damn. I just little. What are you doing back there? It's gone. You're counting.
I am now.
What a good friend you are.
So we're at the phosphate docks there, Boca Grande Pass. Y'all saw Dr. Billy miss about, what, 45?
Oh, yeah.
110?
Yeah,
at least 46. Goliath was messing with him. So now we're offshore. The funny thing is he had a little audience out there as well. They were kind of heckling him, and then we come out, I don't know, 5-6 miles off, and there's another audience to heckle him. So Dr. Billy, you got the pressure on you, man.
That's it. Let's see if we can make this happen.
Do not blow it. He's on. You gotta live. You've been working out for this all your life, since you were 8 years old.
Oh, God. Oh, my gosh, it's a dinosaur. Oh.
Get him, dude. Oh, the slap.
Holy cow.
Dr. Billy on
That
one.
is a monster.
Is that the one that spooled you when you were 8 years old?
Absolutely it was. That's it. Payback for eating that rattle trap when I was 8. Holy cow, it's a dinosaur. Holy cow.
I'm gonna grab you for a second. Dr. Billy, you're a little winded.
Yeah.
He did some cardio before he got out here,
Yeah.
so he did some jumping jacks.
Yeah, I did some jumping jacks. Yeah.
How'd that work out for you?
Not well. No. That thing I thought I was going swimming for a second.
I did almost do the double shoulder
I
grab on
appreciate
you.
that. I appreciate it. A good friend always behind me.
That's
I
right.
don't know if you were going to push or pull, but one way or the other. But we got it done. We got it done, man. That was awesome. That was freaking awesome. There was a big fish. Got it to the boat. Didn't fall in the water.
Right.
We'll go see if we find another one.
Yeah, cool. Good
Be
job.
awesome. Good job, man.
So we're down here in downtown Fort Myers in Southwest Florida, here at Dr. Billy Truax's office. So now we're gonna go in and we're gonna get to know more about Dr. Billy. So hope you enjoy this. So, Dr. Billy.
Yes.
This is our 3-question segment. And so, first off, they've seen you fishing a little bit now.
Yes.
Good and bad.
Yeah.
Right?
Yes.
And so now what we want to do is we want to know about Dr. Billy, the dentist here in Fort Myers.
All right.
So give us a little backstory about your family.
I am a family dentist. It really runs in the DNA. My grandpa was a dentist in South Bend, Indiana, and then my dad was born in Indiana, and he went to dental school in Indiana, was in the Navy, bought this practice after getting out of the Navy in 1976. The practice actually started in 1960. It's an old Fort Myers practice, and so Dr. Anderson started it in 1960. He actually felt the calling to be a missionary, and he went to Africa and preached and did dentistry in Africa, so my dad actually bought it from him in 1976. Dad worked it, and by himself, he's always been by himself, and I graduated in 2008.
From?
University of Florida.
Go Gators.
Go Gators, absolutely. After getting out of school, Dad and I worked together for like a year and a half, 2 years, and I bought Dad out in 2010.
All right, man. You ready for 3 questions?
Oh, I've been dreading this for 6 months. Hurricane Irma has prolonged this, and I'm just worried about what's getting thrown at me now.
It'll be fine. You'll be
All
good.
right,
This is
all
what's
right.
real famous now. 3
Oh,
questions.
yeah.
Yeah, that's what we tell ourselves.
Yeah.
So, first question. This is a viewer question. It's from
Okay.
someone you know.
Oh.
Her name is Cheryl Papasadero.
Oh, goodness,
So Cheryl,
Cheryl.
here's your viewer question coming at Dr. Billy.
Thanks, Cheryl. I can't wait.
Right. Her question was, and I love it because you see it viral, the videos of people, coming off the gas and, they're all out of it. So, like, what is your funny coming off the gas story? I don't know how you really put it.
So this is actually pretty funny. So in my practice, I do not sedate people, but I have nitrous oxide, laughing gas. And so for my patients who are nervous, I have a lot of nervous patients, our slogan is we cater to cowards. So we have a lot of people who come in here who are super nervous. And I have a couple different ways of dealing with those people. One of them is laughing gas. And so when I put somebody on laughing gas, they do not go to sleep. They're completely conscious the whole time. I can tell them to open to close, bite down on my paper, do all this type of stuff so that we can get through our appointment. The nice thing about nitrous oxide is when you shut it off, it's done. You literally get to drive away from here. You don't have to have somebody with you. The viral videos you see is people like when they're getting out of the oral surgeon's office and they have their wisdom teeth taken out, these kids, and they got the gauze in their mouth. They've been sedated.
Is this real life?
Yeah, this is real life.
Really here, we don't get a lot of that. Now, the side effects of laughing gas, it really brings your anxiety level down. And so I say this is like the 2 to 3 beer sensation where you're feeling good,
Okay.
10 foot and bulletproof. And so, you get some people who the ambitions go down a little bit, but some people can become aroused during it. And so you have to be a little careful. And I've had some people hit on me during a procedure or something like that. And so you have to be a little careful. We always have 2 people in the room and things like that. So there are some funny things that go on when that happens, but for the most part, we just brush it off. And a lot of times the people just don't even remember it. Like the next time I
say
see
keep
them.
it PG, man. Our kids
Absolutely.
watch. We gotta take it easy.
Absolutely.
So that's interesting though, because so the viral videos we see aren't really the same thing that you
It is
deal
not
with.
laughing gas. It is sedation where people are actually going to sleep. And there are some people who do that. Like I have a root canal doctor who will sedate people. So I have some people who are just super nervous. A lot of people worry about root canals. Root canals are nothing like they used to be. But some people, just the idea of I have to get a root canal, they say put me to sleep.
So you mentioned already your slogan, we cater to cowards. What are they scared of? And this is question number 2.
Oh, number 2.
Yes.
Okay.
What are they scared of? And then what do you do differently to make them not scared?
The we cater to coward things have been around for a long time. My dad used this slogan back in the 80s, and so it just sort of stuck. And I learned a lot of things from him because a lot of this is taking time and talking with a patient, slowing down a little bit. And so most of us, we're taking our time, we're talking to the patients now. And so dentistry has come such a long ways in the sense of catering to a patient. My big thing is one, if you're in my chair getting something done, you know why you're in the chair, you understand why you're getting something done, and I've educated you about it. So you maybe got your teeth cleaned and I saw a cavity and I've shown you the x-ray on the computer screen, pointed it out and said this is what we're gonna do to fix it. Or maybe you do need a root canal, maybe you need something a little bigger. You should understand why that's going on. I don't tell anybody what they have to do. I educate people and saying here's your options, and then people tell me what I'm gonna do. Because at the end of the day, it's your mouth. You have to tell me what I'm gonna do to your mouth, and you get to make those decisions for yourself. So the main thing is education and taking your time.
Right, and you can basically, I've known you for a long time, can talk to a wall.
I could, yeah.
So like, I could see you really making anyone feel comfortable and
We
educate
can,
them.
yeah, and you know, my assistant's really good. We will, even with the patient open, you always hear people talk, the worst thing is when your doctor's talking to you and your mouth's wide open. And so what my assistant and I try to do is we talk all day long, and I could talk to a glass window and have a great conversation for an hour. So my assistant and I will literally have a same conversation 4 or 5 times in the day. But what we do is we talk to each other and we sort of include the patient, but I'm not asking for the patient of, hey, how was your weekend? I get all that done before I get my fingers in their mouth.
Third question, okay? What is, for our viewers out there, the best thing for them to do to avoid coming to the dentist with problems, or what's the best thing they can do themselves to keep care of their teeth?
Yeah, absolutely. So, I mean, dentistry is really cool because the big thing is almost all of it is preventable. You know, you get some trauma and some fractures and you can trip and fall, but for the most part, almost everything I do is a preventable thing. And literally by brushing your teeth and flossing, the F word, flossing, nobody wants to floss.
Correct.
And so it's one of those things that if you can do that once a day, it can save you tons of time, tons of money. You don't have to sit in this chair. You can get your teeth clean, have good checkups, and leave. Brushing 2 minutes 2 times a day. That's the other thing we get into, especially kids. It's a quick brush and they're out the door. We're all busy. You know, we have tons and tons of busy lives. I give out these 2-minute timers like crazy, little sand timers to kids. If you want to come to my office and get a 2-minute timer, come on in here, I'll give you one. But literally, that's one of the best things you do. 2 minutes a day, or 2 minutes at a time, 2 minutes a day is how you prevent most of this from happening. And if you can floss once a day even, I'd give you a bargain, not do it twice a day. You floss once a day, it would prevent so much of me having to be in the mouth fixing things. And that's the big thing. And I get this where sometimes patients come in, I don't understand, I brush all the time, I brush and I still get cavities. And it's usually one of 2 things. One, there are a few people who it doesn't matter how clean you keep your mouth, you will get cavities because they have bad enamel. But that is a minority of people.
Is it like just a genetic thing then?
Absolutely,
okay.
And it's one of those things that the teeth weren't formed correctly. But a mass majority of these people who like, I don't understand, I brush and I floss, they don't do it well. And what I do is I give them those little tablets that you got when you were in school, or that little drink that you would drink and spit out and you would see the red on your teeth. I have tablets that I make people chew up, spit out, and you can see the plaque that's less than 24 hours old and the plaque that's older than 24 hours old, meaning you've missed it for more than 24 hours. The last 2 brushings, you didn't even get to this spot. You have something bleeding when you brush your teeth, that means you're not doing a good job brushing your teeth and you need to go after it a little harder. And so you get somebody who's like, hey, I've had this problem for the last month up here and they haven't put a toothbrush up there for the last month. That's not a good situation because you've just amplified the problem just exponentially.
So that's Dr. Billy. You guys know more about him now. You're watching the fishing show, so we're gonna let you get back to it. Make sure you look him up. We can put all his contact information in our comments below. So enjoy the rest of the show. On again. I'm here for you, man. I got your back. Smaller, isn't it?
He isn't tugging his heart.
Much smaller than the other one.
He just realized what's going on here. Nice.
Oh, cool, man.
Another dinosaur from the deep.
Whoa! Get some.
Little head shake like a big bass.
Got myself another Goliath. Going bye-bye.
Another one.
Oh, it's a little better one here, Billy. Get it, Billy.
Oh, yeah. I'm trying.
Ride that way. Stand that way. You're walking that way. For real.
Oh. Yeah. Yeah. Yeah.
You are getting in the water now, dude. Look at that thing. Oh.
Man.
Nice job.
Versus beast. Oh.
Wow. God, look at that thing, you guys. Look, he only had to go to like 58 bites to get this one. We're proud of you,
Oh,
man.
thank you. Oh, yeah. Just brought up
How
a
you
beast.
feeling?
Oh, my goodness.
Let me hold it for you.
All right. Oh, out of breath, but this is awesome. This is what I was going for today.
This is
awesome.
8-year-old Billy Truax.
It
You
is. This
finally
is-
got him.
Captain Bo put us on this monster, dinosaur of the sea. Payback, 8 years old. Big Goliath. My parents can now steal my rattle trap. This is redemption. Here we go. Captain Bo put us on a big monster. Here he is.
Doing good.
We did good. Tim, thank you very much for the opportunity. It's awesome. This is my lifelong dream. Catching a Goliath, going swimming with it. This is awesome.
I'm so proud of you, man. I'm so proud of you. Good job, buddy. All right, you guys, that wraps up this episode of Rates and Reels. Dr. Billy, what'd you think?
It was epic. I got something off my bucket list. It was a heck of a day. Had a lot of fun. Captain Bo put us on fish. I mean, we had a good day. I can't think of anything else I want to do today.
Right.
Great.
On behalf of St. Michael Lutheran School, thank you for donating to be on this episode. So I'm sure they all appreciate it. So good job there, buddy.
Thank you very much.
Yeah. His dream when he got the show was, Tim, I want to get a Goliath Grouper. I want to get on it. I want to catch a big one. I want to jump in the water with it. And you did it.
We
right?
did. We completely accomplished that.
Yeah, well, good job, man. And so when he said that, asked around, and the one guy that came up that people recommended was Captain Bo Johnson. So he did it today, put us on him. Big thanks to him. Really appreciate that. So, Dr. Billy, anything else you want to say?
No, thank you. I
Yeah,
appreciate
man, you
it. Thank
got
you,
it, dude.
Tim. Thank you, Captain Bo. It was a great day.
Any kind of dental work you guys need, Dr. Billy Truax down on McGregor, downtown Fort Myers. Your dad, right, started the business.
Yep.
All right,
I'm a third-generation dentist. You need anything at all, by all means, give us a call.
Good deal. Well, you guys, hope you enjoy the show. Don't forget to like, share, and subscribe to our YouTube page. And again, this is Tim Hart, Van Dyke Mortgage, wishing you low rates and tight lines. Have fun, everybody. Thank you.